When we come back, the good doctor's going to be back helping you get rid of your headaches. So we're talking about headaches right now. Lord knows Dave knows about headaches, at least as far as women are concerned. Dr. Steve is here now.
Well, women just constantly tell them they have a headache. Jim, studies show that more than 80% of us get headaches. 99% of Dave's dates get headaches. Been talking to us this morning about the causes and cures. Dr. Jerry Simon, he's a dentist and author of Stop Headaches Now. Good morning. Thanks for joining us.
Good morning. Well, thank you very much.
Okay, so headaches, everybody has headaches at least one time in their life. But what are some of the major causes of headaches?
Well, there are two groups of headaches as I define them. One is what I would call the metabolic lifestyle headaches, the more mild kind. And that could be people who have stress, people who eat the wrong foods, maybe people who eat certain cheeses, people who drink red wines, people who don't get enough rest, for example.
Right, so I guess an important thing for these people is to identify those triggers. And this might sound like it's a setup, but literally just the other day, somebody came to me at my desk and said, "Hey, Dr. Steve, I notice every time I eat chocolate, I get a headache." And I said, chocolate's a real trigger for headaches.
Yes, for some people it is. And for those people, instead of reaching for the drugs and for the Advil and the aspirin, those people have to identify those things and make some lifestyle changes or dietary changes, and they can stop their headaches.
So what are some of the other treatments for headaches?
Well, the other kind of headaches, which are the more serious kind that trouble people quite a bit more, are the more severe tension headaches, the TMJ headaches, and migraine-type headaches.
Now, we should say you are a dentist, actually,
yes.
and a lot of people don't realize that dental problems cause headaches, even migraines.
Very much so, because what happens is if people's bite is off and they clench or grind their teeth, they can get soreness in the jaw muscles, because the jaw muscles literally wrap around the entire head. Even if you put your hands on your temples, you can feel your muscles as you clench your teeth together. And those muscles can send pain messages into the brain, which in themselves can hurt, and they can actually trigger migraines.
So how would someone be able to identify the fact that they're clenching at night or they have TMJ, some of the warning signs?
Well, any person who's getting headaches that they can't easily identify a cure for should suspect that their bite may be a part of the problem.
Now, I also found in my practice, a lot of people would come in and say, "Oh, I have migraines." And you talk with them and get a history, and it turns out they've never been officially diagnosed with migraines. No one's ever worked them up for their headaches, and they just assume they have migraines. And that can be a dangerous situation, because not all headaches are benign, simple things, right?
No, absolutely not. And the problem is that the term migraine, well, first of all, there is no X-ray, blood test, CAT scan, or MRI that can determine whether a person is or isn't getting a migraine headache, a TMJ headache, or a tension headache. So it's an anecdotal diagnosis. They tell the doctor, and the doctor can make suppositions based on their reports. And so you're right, you can't make an assumption. And that's why it's important that you have proper screening.
Right, because there are a lot of people that unfortunately have had headaches. They think they have chronic headaches, and sometimes they go to bed and wake up and they don't wake up.
They don't wake up. Yeah. Well, if a person has a sudden, without a history of headaches, if they have a sudden severe headache that seems to come out of nowhere, they should definitely go to an emergency room, dial 911, because that literally could be an aneurysm or something that's very, very serious and life-threatening.
Something I've seen in my practice a lot. Now, I understand the gang at the table has a huge headache, and they have some questions they want to ask you.
He's sitting right there.
Well, you're staring at me.
Can you remove it?
Can you remove it? No, seriously, do you guys have, I know Lynn suffers from sinus headaches, right?
Yes, I get sinus headaches, and sometimes it's hard to know the difference. I don't usually get a regular headache, but every now and then I'm not sure which is which.
Well, what I did with a lady who did my makeup a couple of minutes ago is she was getting headaches, and she rated her headache pain from 1 to 10, her head, her neck, her shoulders, Sonia, and I used my little device that I've invented to diagnose people who get TMJ headaches, and we got her out of pain in 35 seconds.
So now she's pain-free. But the thing about a headache, too, you shouldn't wait until it gets so bad that you're debilitated. You want to find out what's causing it and start treating it early. Any other headache questions from you guys?
I actually have a silly question. When I eat cold food, I get a headache. And we joke about it, the behind-the-eye frozen yogurt headache. What is that? What causes it, and is there a way to prevent it?
It could be from a couple of different things. Obvious things, don't eat foods that's that cold.
Well, here, don't eat cold food.
Don't eat cold food. When I raise my arm like that,
it hurts. We'll have to take Dave's question over the commercial break, because we got to go. Dr. Jerry Simon, thanks so much for coming.
Thank you very much.
You got your answer. Don't eat ice cream.